A woman died because hackers encrypted a hospital. September 10, 2020. Düsseldorf University Hospital, Germany. A 78-year-old woman arrives by ambulance. She needs emergency treatment. Critical condition. Minutes matter. But the hospital cannot help her. Every computer screen shows the same message. 30 Bitcoin or your data stays locked forever. The hackers had struck 6 days earlier. They encrypted 30 servers. Patient records gone. Diagnostic systems frozen. Operating rooms offline. The emergency department shut down. Ambulances were being diverted to other hospitals. The woman was rerouted to a facility 20 miles away. She died during transport. Prosecutors opened a negligent homicide investigation. The first confirmed death caused by a cyber attack. But here is what nobody knew at the time. The hackers never meant to hit that hospital. They targeted someone else entirely. And the truth about who was really responsible would shock the entire cybersecurity world. September 4, 2020. 2 a.m. Düsseldorf University Hospital operates one of Germany's largest medical centers. 4,000 employees. 60,000 patients annually. Someone clicks a malicious link. Nobody knows who. Maybe a doctor checking email between shifts. Maybe an administrator working late. One click. That is all it took. The malware spread silently through the network. It is called Doppelpaymer, a particularly vicious strain of ransomware. Built by a group the FBI tracks as Evil Corporation. Yes, that is their actual name. These are not amateur hackers in a basement. Doppelpaymer attacks had already netted over $40 million by 2020. They target hospitals specifically. Why? Because hospitals pay. They have to. Lives depend on those systems. The encryption algorithm is military grade. Unbreakable without the key. By dawn on September 4, 30 critical servers are locked. The hospital IT team discovers the breach at 6 a.m. Panic sets in immediately. Electronic patient records are inaccessible. Lab results cannot be retrieved. MRI machines will not communicate with the network. Chemotherapy pumps frozen. Ventilators running on backup protocols. The staff reverts to pen and paper. Like it is 1970. But modern medicine does not work on paper anymore. A surgeon cannot operate without imaging. An oncologist cannot dose chemo without digital records. The emergency department makes the call. They shut down ambulance intake. Too dangerous to accept critical patients. What happened next made everything worse. The ransom note appears on every infected machine. 30 Bitcoin. Worth approximately $400,000 at the time. Payment deadline, 72 hours. Standard Doppelpaymer protocol. The note includes contact information. An email address on a dark web server. The hospital administrators face an impossible choice. Pay criminals or risk patient safety. German law enforcement gets involved. The Federal Office for Information Security. They advise against payment. Funding terrorism. Encouraging more attacks. No guarantee the decryption key even works. But the hospital is hemorrhaging patients. Ambulances diverted to Wuppertal. To Cologne. To facilities 30 miles away. Critical care patients being turned away. Then investigators discover something strange in the ransom note. It addresses the Heinrich Heine University. The university shares the same campus. Same network infrastructure. The hackers hit the wrong target. They wanted to encrypt university research data. Academic secrets. Grant proposals. Instead, they locked down a hospital. The FBI estimates Doppelpaymer hit over 40 hospitals worldwide in 2020 alone. Total damages exceeded $300 million. But most hospitals pay quietly. They do not report it. Bad publicity. Liability concerns. Insurance covers it anyway. Cybersecurity experts call this the invisible epidemic. Here is what nobody tells you. The encryption is just the beginning. Doppelpaymer also steals data before locking it. Double extortion. Pay us or we decrypt. Pay us again or we leak your patient records. Social security numbers. Medical histories. HIV status. Cancer diagnoses. All for sale on the dark web. The hospital administrators begin negotiating with the hackers. Back and forth over encrypted email. The 72-hour deadline passes. Still no payment. The hackers do something unexpected. They send the decryption key for free. No ransom paid. $0. Why would criminals give up $400,000? What they discovered next changed everything. The hackers realized they killed someone. News reports had gone international. A woman dead because of diverted ambulances. German prosecutors investigating negligent homicide. The Doppelpaymer gang panicked. They released the key on September 14th. 4 days after the woman died. They even posted a statement on a dark web forum. We do not target hospitals. This was a mistake. We are not murderers. Cybersecurity researchers preserved the statement. It is the first time ransomware operators acknowledged causing a death. But prosecutors did not care about their remorse. They wanted arrests. The investigation led to Russia. Of course it did. Evil Corp operates from Moscow and St. Petersburg. Protected by the Russian government. The FBI had indicted Evil Corp's leader in 2019. Maxim Yakubets. Charges include conspiracy, computer fraud, wire fraud. $5 million reward for information. The largest bounty ever for a cyber criminal. He is still free. Still operating. Russian authorities refuse extradition. Yakubets lives openly in Moscow. Drives a customized Lamborghini. License plate reads thief. Not even hiding. U.S. Treasury Department sanctioned him in December 2019. Anyone doing business with him faces prosecution. But the attacks continue. Here is the thing about ransomware deaths. They are almost impossible to prove legally. Did the woman die because of the diversion? Or would she have died anyway? The ambulance delay was 43 minutes. Would those 43 minutes have saved her? German prosecutors investigated for 18 months. They dropped the case in May 2022. Insufficient evidence. Cannot prove causation beyond reasonable doubt. The hackers walked. Nobody charged with her death. But the attack exposed something terrifying. Hospitals are completely vulnerable. The U.S. Cybersecurity and Infrastructure Security Agency issued an alert in October 2020. Imminent threat to healthcare providers. Ryuk, Conti, and Doppelpaymer actively targeting hospitals. Over 400 healthcare facilities hit in 2020 alone. Just in America. The financial impact topped $21 billion. $21 billion. And that is only reported attacks. Most stay hidden. Insurance pays quietly. Patients never know. The Vermont Health Network got hit in October 2020. 6 hospitals offline for 28 days. The University of Vermont Medical Center. Chemotherapy delayed. Surgeries postponed. Patients transferred. Cost, $63 million. Sky Lakes Medical Center in Oregon. September 2020. 10 days offline. Ransom paid undisclosed. Scripps Health in California. May 2021. 4 weeks to recover. Cost, $113 million. These are not isolated incidents anymore. This is the new normal. Healthcare ransomware attacks increased 213% from 2019 to 2023. The average hospital now faces 3 serious cyber attack attempts per week. Most healthcare systems run on outdated software. Windows XP still powers many medical devices. Equipment manufacturers do not issue security patches. Too expensive to certify updates. An MRI machine from 2010 will never get patched. Ever. It runs vulnerable software until it physically breaks. 20 years in some cases. Hackers know this. The Department of Health and Human Services requires breach reporting, but only after patient data is confirmed stolen. A ransomware attack that just locks systems? Not always reported. The woman in Dusseldorf is not the only victim. She is just the first we can prove. How many others died from delayed care? From postponed surgeries? From diverted ambulances? We will never know the real number. Cybersecurity experts agree on one thing. This will happen again. Hospitals remain the softest target in critical infrastructure. The most likely to pay. The least able to defend. Your medical data is worth 10 times more than credit card numbers on the dark web. Everything about you. Every diagnosis. Every prescription. Every secret you told your doctor. And the people protecting it are overwhelmed. Underfunded. Running on systems from 2005. If a story like this made you realize how vulnerable we really are, then subscribe. Because we investigate one new dark truth every week. The next one reveals who is buying all that stolen hospital data, and what they are doing with it will disturb you even more. Subscribe for a new dark truth every day.